Hello everyone. Today we're going to demonstrate Botox. I know that everyone has been excited about cosmetic procedures and what type of procedures we offer, what can be done and for what purpose. Botox is a type of treatment that you can use to relax the muscles of the face. Now, a lot of times people say, well, I don't want to do cosmetic procedures because I don't want to look plastic. The nice thing about Botox is if you use it appropriately, if it's injected right, then you actually don't look plastic. You look relaxed, you look like you've had a good night's rest, and that's ultimately the look that we're looking for. Like, you know, everything is at its best and you're essentially putting your best face forward. So we're gonna go ahead and start right here. Now, many individuals start out with Botox, but there are certainly other treatments that you can do. This is what we're going to be doing for Jessica today. Go ahead and raise your eyebrows up. We've already identified areas that we want to treat. Yes, thank you. And we basically want to treat right here between the eyebrows. Raise your eyebrows up. We want to treat these lines across the forehead. And then you want to wrinkle your nose and the bunny lines. And we're just doing a little bit, just a touch. We're not overdoing it, just to help her look like she's had a good night's rest. So we're going to go ahead and get started. Just wiping down the area. Because we are going to be injecting. Okay, now bring your eyebrows together. Okay. And relax. And bring your eyebrows together again. And relax. Bring your eyebrows together again. And relax. Okay. Now we're just going to massage it in. Give it a little bit of time to take effect. It takes actually up to 4 days. Some individuals are really lucky and within 2 days they begin to see that. But not everyone. Most individuals don't. All right, now we're going to move on to the forehead. Raise your eyebrows up as high as you can. Okay, and we're going to go straight across. And we can see where there's some blood vessels here. We want to essentially attempt to avoid those. Okay. Raise your eyebrows up and relax. 1, 2, 3, little poke. Some pressure. Okay. Raise your eyebrows up and relax. 1, 2, 3, little poke. Okay, good. Good. And raise your eyebrows up. And relax. 1, 2, 3, little poke. Raise your eyebrows up. Relax. 1, 2, 3, poke. And now, because we've done this over and over again with Jessica, we already know what her injection pattern is. Everybody has their own unique injection pattern, and we basically develop that over the course of time. Frequently, we start out really low and we just start adding slowly so that we know exactly where we need to inject and we don't over inject. So it's always best to under inject because you can always add. So in this case, I already know that Jessica needs a few little added units outside on the forehead, and so we're gonna go ahead and do those as well. Okay. Raise your eyebrows up and relax. 1, 2, 3, poke. Raise your eyebrows up. Last time. Relax. Again. Relax. 1, 2, 3, poke. Okay. Now we're just going to take a little moment to massage it all in. These muscles of the forehead, on the forehead, are running up and down, and so we're trying to get it in. We want to be sufficiently away from the eyebrow so that it doesn't drop the eyebrow, because nobody wants this kind of look where the eyebrows are flat. But yet we'd like the entire forehead to experience that nice relaxation that Botox gives. That resting face, like, yes, I slept 10 hours last night, didn't you? Jessica's gonna now have that for the next 3 months. Let me come here this way. Okay, now the bunny lines. Yes, wrinkle your nose. Okay, relax. Wrinkle again. Relax. 1, 2, 3, poke. And one more on the other side. I'm gonna squeeze them here. I think you can squeeze that one. Wrinkle your nose and relax. 1, 2, 3, poke. Okay. All right, and now all we have to do is massage them in. And see, because we took a look, now it's not always the case, but because we took a look at her face, we saw where the vessels were at, you know, we avoided those vessels accordingly. We were able to do it with just a few injections. These are very tiny needles. She tolerated it really well. There was essentially very minor bleeding, and that's not atypical. That's pretty much usually what we see. Now, every once in a while, we may actually hit a vessel and there might be some bleeding. That's normal. It does occasionally happen. We just put some gentle pressure and it stops. It's not uncommon for somebody to have like a little bruise right there where that vessel was poked. If that happens, you can easily cover it up with makeup for the course of maybe a week at the most, and it fades, and you have the lasting effect of Botox for weeks and months even. Usually it's not uncommon when somebody is first starting out to need Botox every 3 months. Well, I should be very careful and not necessarily use the word need Botox, because nobody needs Botox, but to get the lines back and benefit from Botox. And we all would like to benefit from Botox because it does give you a more relaxed appearance, like a refreshing look, like you're doing well. So I wanted to demonstrate that so you could see, because I think there's a lot of misconceptions of what is out there. And I highly recommend that if you are considering getting Botox done, I highly recommend that you seek a board-certified dermatologist or a team that's supervised by one so that it can be done appropriately. From the Alamo City, this is Dr. Ana Sauceda helping you put your best face forward. Take care.